Hello, and welcome to Med Evidence Articles, where we encourage community research and education with weekly articles. I'm your host, Benton Loibal, and this week we are talking about polycystic ovary syndrome, also called PCOS. The Mental and Physical Toll of PCOS by Maya Yanchuck. Remember the infamous bearded lady showcased as a circus attraction in Barnum and Bailey's freak shows? You may have seen depictions of her in The Greatest Showman or Ripley's Believe It or Not museums. It turns out that she wasn't really that freaky at all. Annie Jones, the bearded woman, likely experienced extreme hirsutism, or male-like facial hair growth, as a result of having a high amount of male hormones. However, many females with high amounts of male hormones will have coarser or more visible facial hair growth, but not a full beard. Other famous bearded women from history and myth include Josephine Clofullia, Jane Barnell, and the witches from Shakespeare's Macbeth. Polycystic ovary syndrome, or PCOS, is a hormonal disorder that is diagnosed when at least two of the following are present: menstrual abnormalities, excess of male androgen hormones, and/or ovaries with a polycystic structure or morphology. Symptoms present in women with PCOS may include mood instability, male-like facial hair growth called hirsutism, weight gain or a hard time with weight loss, oily skin and acne, difficulty becoming pregnant, or menstrual misses or irregularities. Other health complications linked to PCOS are type 2 diabetes, obesity, infertility, metabolic syndrome, inflammatory gastrointestinal tract issues, mental health issues, insulin resistance, and an increased risk for cardiovascular disease, breast cancer, and endometrial cancer. PCOS is complicated because many different factors can contribute to it, including genetics, environment, lifestyle, and stress. It is also a heterogeneous condition, meaning not everyone will present with the same symptoms, and symptoms may sometimes overlap with those of other conditions. This makes diagnosis challenging. Physical health plays a major role in PCOS symptoms. Hormones such as insulin, estrogen, testosterone, and others that regulate ovulation can become dysregulated. Insulin resistance is very common in people with PCOS. It occurs when the body does not respond properly to insulin, the hormone that regulates sugar in the blood after eating. This may lead to higher blood sugar levels, weight gain, difficulty losing weight, and increased androgen production. It is typical for PCOS symptoms to worsen over time through a bidirectional feedback loop, or positive feedback loop. For example, weight gain can worsen insulin resistance, which can lead to increased weight gain. Other cycles may include the relationship between insulin resistance and high testosterone, or between low estrogen and metabolic syndrome, also called MET-S. These cycles can make the condition harder to manage. Epigenetics, when the environment changes genetic expression, may also influence PCOS. A person may inherit genes that increase their risk for developing the condition, but environmental factors such as diet, stress, illness, or trauma can affect whether those genetic risks result in PCOS. A common analogy is to imagine a light switch. When trauma occurs, the gene switch is flipped on or off. In this way, genetics, life experiences, and even certain lifestyle choices may contribute to the condition. This is important to understand because PCOS is highly heritable. In fact, there is a 5-fold increased risk for the daughter of a woman with PCOS to be diagnosed with it as well. Mental health is another important part of PCOS, especially when stress or trauma collides with epigenetics. Symptoms like weight gain or excess hair growth can impact self-esteem and emotional well-being. Many individuals with PCOS reportedly experience higher levels of stress, anxiety, or depression. Stress can worsen physical symptoms, emphasizing how closely mental and physical health are connected. PCOS treatments target individual symptoms and do not necessarily help the problem as a whole. Some medications like birth control can be used to increase female hormone presence in the body, but must be administered carefully, as too much or too little of the supplemental hormone may bring about other health complications. These medications are meant to facilitate the metabolic processes of what the body should already be doing on its own. Other medications commonly used include spironolactone or metformin to treat high amounts of male hormones and other symptoms like weight gain, acne, and insulin resistance. Lifestyle changes like diet and exercise and mental health support, such as counseling and support groups, have the potential to mitigate symptoms associated with stress. PCOS is a complex condition that impacts both the body and the mind. Understanding how hormones, genetics, the environment, and mental health interact may help improve diagnosis, treatment, and long-term care for people living with the condition. PCOS should be treated as a multifaceted issue in order to target symptoms from all angles. Returning to Annie Jones, it is very possible that high amounts of androgens that caused her facial hair were a symptom of what we now recognize as polycystic ovary syndrome. With today's medical understanding, it's clear that she was not a freak, but a woman living with an untreated hormonal condition. Thanks for joining us on this week's episode of MedEvidence Articles. If you'd like to know more, all of our sources are linked in the podcast description. You can also visit our website at medevidence.com. MedEvidence provides evidence-based information that empowers individuals to make informed health decisions. We present unbiased clinical research in clear, accessible formats guided by medical experts and provide education for patients and healthcare professionals with a focus on research as a care option. Note that the information provided in this podcast is for general educational, scientific, and informational purposes only and is not intended as and should not be treated as medical or other professional advice for any particular individual or individuals. If you're experiencing any medical issue or have any medical concerns, you should consult a doctor or other medical professional. For more great content, including discussions by physicians and subject matter experts, check out the MedEvidence podcast. My name is Benton, and we'll talk to you next week.